Let's talk about coronavirus. It started with a handful of deaths recorded in the Hubei province of China, leading to a lockdown of the city with over 11 million people, Wuhan. Well, the novel coronavirus has spread well across continent. As we speak, Iran's deputy health minister has been infected, and parts of Italy is on lockdown after it killed 11 people there, and that's adding to several other European countries which have recorded cases. So far in Italy alone, over 300 people have been infected. So what are the latest preparations being taken at the EU level? You do know that Germany also has a number of infections. Well, William Gilcroft is correspondent for our partners, the DW. He joins us from Berlin in Germany with the pros and cons of what's been done. William, thank you very much for your time and good afternoon. What more do we know as far as how this coronavirus spread to Italy, which is also the latest country to be on lockdown?
Good afternoon to you, Gifty. It's always nice to have a chance to talk to you. Yes, these numbers in Italy really skyrocketed seemingly overnight over the weekend. It seems to have been from people coming back from China from affected regions, and then it seems that the original cases in Italy were just passed off as standard flu. They were treated for flu and sent home, but then those conditions got worse among that first patient and first couple of patients. And of course, if you don't catch it right at the beginning, that allows more time for infected people to expose themselves to other people, and it can spread very quickly from there on out. And that's what's happened, it seems, in Italy. But of course, in what has health officials so concerned is what they don't know, because there's still much about this disease we don't know about how it's spread and just how dangerous it is. Although current number of confirmed cases is very low, there may be many, many more cases that have been undetected, either because they haven't been tested for it, or people are not reporting it, or people only have mild or even no symptoms, or it could be confused with other diseases like the regular flu. Remember, it is the flu season right now, so there are many people suffering from just regular seasonal flu. So it's a very complicated situation, and that makes responding to it also very complicated. Health officials in Europe say it's a serious situation, but by no means any reason to panic.
Well, any reason to panic? It is indeed a complicated situation, but Germany has had its own share of it before. Italy had its own. So I'm sure there are lessons from Germany for its European counterparts. Tell us about preparations to deal with this at the EU level.
Yes, there are, it appears, 17 or have been 17 cases of corona in Germany. 2 new ones were registered just last night. One, we're being told, he's in stable condition. He's recovering quite well. The other man in Western Germany, we're told, is in more critical condition. But these have been still isolated cases where the people have been able to be isolated and receive medical treatment rather quickly. So it hasn't spread very rapidly. That said, it is appearing in more European countries as we speak. Greece has just announced it has cases. As I just said, there are probably many cases that have not been reported. France has another death just this morning, another death reported from coronavirus. But health officials say exactly not to panic, that there's no reason to close borders. There was a discussion about closing borders, or at least increasing checks and controls at borders. That has so far not been the case. Many officials are saying closing borders is pointless when disease can easily cross borders, whether those borders are closed or not, whether travel is suspended or not. At the same time, people coming from affected regions are being asked to self-isolate if they show symptoms, or being asked to report themselves to medical officials if they show symptoms, so that this can be caught, nipped in the bud, so to speak, very quickly, so that this does not become a pandemic that many people are fearing. At the same time, the European Commission, that is the executive arm of the European Union, they are asking the member states of the European Union to prepare and review their pandemic plans so that countries can be as prepared as possible. European Union health officials are exchanging information on a regular basis. And otherwise, it's just a matter of very simple hygiene, things that we should always do in an everyday basis to guard off all kinds of diseases. Wash your hands thoroughly, stay away from sick people, stay out of work if you feel that you're sick, and if you are sick, go to a doctor. So very basic things that individual people should be doing to help stop the spread of this coronavirus and many other kinds of diseases.
Well, as the countries within the Europe, for example, work on reviewing their pandemic protocols, let's focus a bit more on the pros and cons of evacuating people. It's been one of the thorny issues. We know that the U.S. and European countries have evacuated some of their citizens, but some African countries have as well, but not all African countries, especially here in Ghana. There are calls for it. Our government has said that it is not out of the picture, or it's not off the table, but it is not happening anytime soon. So let's take us through the pros and cons of evacuating people from China. What are the lessons to be learned here?
Yeah, indeed, as you say, some countries, especially those with the resources and the funding to be able to get their people out and return them to their home countries and then take care of them in their home countries, like the United States, Germany, Japan, they've been doing it. Countries with fewer resources and less ability to do that, like many countries in Africa, have not been able to do that, have made the choice to leave their nationals in places in China where the coronavirus disease is quite widespread. That's come under a lot of controversy. For Ghana alone, there's an estimated 300 to 500 students, Ghanaian students in the Hubei province in China where this outbreak began. That's according to a development group called Development Reimagined. I was speaking with the CEO of that consultancy group. They're based in China. They are keeping track of students from all across Africa who are in China for various reasons. They say there's a total of about 5,000 African students still stuck there. Now, they've been criticized for not doing enough to get them out, but on the other hand, many government officials from various African countries are saying if they were to be brought back to their home countries, it would actually raise the danger of spreading the disease because these countries don't have the facilities or the resources to quarantine, to test, and to treat patients like they do in China and like they do in other countries. So that's one strong argument for keeping people in the place where they are in China, and if they're sick, not come back to their home countries, but to seek treatment in the cities in China where they're at right now. So that's the pros and cons to whether or not to evacuate that many countries are struggling with right now.
William, thank you so much for helping us with these analysis and the research as well, the backseat. Hopefully we all keep safe away from the coronavirus. As people have said, it's not a matter of if, it's a matter of when it becomes a pandemic, but hopefully we'll be able to keep a handle on this. William Glowcroft is a correspondent.
Stay healthy.
Right. William is a correspondent with our partners in DW. He joins us all the way from Berlin in Germany. This is Still the Pulse with me, Gifty Ando up here. Do stay safe wherever you are and whatever you do. Keep washing your hands. We've taken you through. You report yourself to a nearby hospital for treatment. Keep watching.